told that you're going to need a laparoscopy, perhaps for a gynecological procedure like having a hysterectomy, a sterilisation, or endometriosis. My name's Brooke, I'm an obstetrics and gynecology doctor, and I'm here to talk to you about what you can expect from that procedure. In this video, we're going to run through what a laparoscopy actually is, what you can expect to happen on the day, what you can also expect from your recovery, some top tips to help you heal, when to go back to work, etc. So let's get right into it. First up, what is a laparoscopy? Well, a laparoscopy basically means a surgery, an operation that is done to see inside the abdomen, in the tummy, without making any large skin incisions. It's known as keyhole surgery. A diagnostic laparoscopy means that you're simply putting in a camera inside the tummy, so a small tube that's known as a laparoscope is inserted usually through the belly button, but sometimes we insert it in another part of the tummy first. It has a light on it and a camera, and that gives images of the inside of the abdomen. A diagnostic laparoscopy is used to identify a cause for your symptoms, so if you don't know what's going on, and also to help to plan treatment. But we also do operative laparoscopies, which means that we do this procedure to look inside, as well as using additional instruments to actually treat the problems such as endometriosis. Laparoscopy can help you to find out if you've got any of the following conditions. So if you've got endometriosis, where cells that are similar to the lining of the womb are found elsewhere in the body. Also, it could show up having had a previous pelvic infection. It may show that you've got some scar tissue, for example, from a previous surgery. It can help to reveal or identify if your fallopian tubes are damaged or blocked, and it can show ovarian cysts. Sometimes we don't find anything abnormal during a diagnostic laparoscopy. If minor problems are found during this diagnostic first laparoscopy procedure, such as a small area of endometriosis or some minor scar tissue or a small cyst, they can be treated during your operation. But if there's more complex problems that are identified and you've been planned to just have a diagnostic laparoscopy, you may need to have another operation on a different day. What are the advantages of laparoscopic surgery? Well, the advantages include a faster recovery and a shorter hospital stay, less pain and bleeding, and reduced scar tissue. If you are going to have a laparoscopy, you'll have a pre-op assessment with your doctor at some time before you have that laparoscopy. That's the best time to discuss any questions or concerns that you have, and also to discuss what treatment you would like to have if there's any problems found. During this appointment, a nurse will usually perform some simple tests that are required for you to be fit enough to have the operation. So that might be some blood tests, an ECG, so a trace of your heart, and potentially a physical examination as well. And you should also bring a list of your current medications to this appointment. They'll give you specific advice for you about, for example, when to stop eating and drinking, but usually you'll be asked not to eat or drink anything for 6 hours prior to your operation. What should you bring with you? Well, although a laparoscopy is commonly a day case procedure, sometimes you might need to stay overnight or even longer if, for example, they're treating some endometriosis, or if there's complications, or if you're having a hysterectomy. So it's often worth taking a small overnight bag with you, even if you've been told it's just a day case, just in case you end up staying. You can bring your own slippers and a dressing gown to help give you some comfort when you're on the ward. Now, you should have someone with you to look after you after your laparoscopy. So even if it's just a day case, you should arrange for a partner, a friend, or a family member to come and pick you up from the hospital and make sure that you're not alone overnight afterwards. You can also ask them to bring a pillow or a rug to bring in the car for the journey home, because the seatbelt can cause some discomfort against your stomach, and you might also feel a bit cold. It's possible you might vomit in the car depending on how long your journey is, so bring a bag or a bowl just in case. It's worth noting that you may be told that you shouldn't shower for up to 48 hours after the laparoscopy, so you might want to make sure that you shower before you go into the hospital. So what does the operation actually involve? Well, for this operation you'll need to have a general anaesthetic. The anaesthetist will tell you in detail about this on the day, but once you're asleep, your abdomen and the vagina will be cleaned with a pink or a brown cleaning fluid. Your bladder might be emptied with a small tube, a catheter, and this will not be present usually when you wake up, but sometimes it might still be there. The gynaecologist will examine your vagina and your abdomen to assess how big your womb is, and then they'll often place a small instrument on your cervix, on the neck of the womb, via the vagina to help to move the womb during the operation. And this is removed before you wake up, but because you have this placed inside the cervix, you might experience a little bit of vaginal spotting after the procedure, and you might feel a little bit sore down below as well. The small cut will usually be made on the tummy, in or near your belly button, and then the laparoscope is inserted through this cut, and then the abdominal cavity is filled with gas, carbon dioxide. Sometimes if you've had other operations before, we're extra worried about the scar tissue, we may start with the first port being placed in a different place up by your ribs. The surgeon will usually make that decision on the day. Then a port is a small plastic tube that allows the instruments that are required for the operation to be inserted into the abdomen, and they'll then be placed. Sometimes more than one port is needed. It's common to wake up and you've got 3 or 4 incisions where the ports have been placed. After the procedure, the gas is then released from your abdomen and we use stitches or glue to close those incisions over. Dressings are then usually placed over these wounds. The operation itself, if it's just for a diagnostic reason, usually lasts between 20 and 40 minutes, but if an additional procedure is taking place at the same time, it could be an hour up to 3 or even 4 hours. And the surgeon will usually be able to give you an indication before you go to sleep of how long they expect the procedure to take, but everyone is individual. What complications are possible do you need to be aware of? Well, laparoscopy is a commonly performed procedure. Serious complications are rare, thankfully, and minor complications occur in approximately 1 to 2 in every 100 cases. So that's about 1 to 2%. And those minor complications include wound infection or gaping, urine infections, and minor bleeding or bruising around the incision sites. Sometimes you can experience shoulder tip pain caused by the gas or feeling sick and vomiting. There are more serious complications to be aware of that the surgeon will usually explain to you, but that can include damage to your bladder or your bowels, blood clots in the legs and in the lungs, and severe hemorrhage. What can I expect after a laparoscopy? Well, usually the length of stay in hospital, if you're having a diagnostic laparoscopy, means that you should be able to go home the same day. This operation is usually done as a day case. However, if you know that you're having an operative laparoscopy, so you're having a hysterectomy, you're having treatment for your endometriosis, you may be told in advance that you should expect to stay 1 or 2 nights. When you wake up from your anaesthetic, your nurse will usually want to make sure that you're not in pain and that it is safe for you to go home if you're planning to be discharged. It usually takes about 3 to 4 hours after your operation before you'd be safe to go home. And when you do go home, make sure that you're not alone and someone can stay with you overnight. How might you feel after your laparoscopy? Well, following a laparoscopy, the excess gas can cause a bit of discomfort. You might find that having some peppermint oil or peppermint tea can help to ease those symptoms. Because you have a tube inserted in your throat to help you breathe during the laparoscopy, your throat may feel a bit sore afterwards. You will expect to experience a little bit of vaginal bleeding or spotting. You've just had an anaesthetic, so you'll probably feel a bit groggy and nauseous, and you might even need to vomit. Most modern anaesthetics are short-lasting, and you shouldn't have many after effects for more than a day after the operation. During the first 24 hours after having the anaesthetic, you might feel more sleepy than usual and your judgment might be impaired. Ideally, you should have an adult, someone with you during this time, and you shouldn't drive or make any important decisions. For the first couple of days after your laparoscopy, you need to rest and let your body recover from the procedure. Gently moving around will help any excess gas to leave the body, but don't overdo it. It's normal to feel weak and tired for about 10 days following a laparoscopy, perhaps longer if you've also had surgical treatment at the same time. You will have between 1 and 5 small scars on different parts of the tummy. One scar will usually be in your belly button, the others will be arranged around the lower part of the abdomen. Each scar will be about 1/2 centimetre to 1 centimetre long. Your cuts will be closed usually by stitches or glue, so do be careful when you're bending over, stretching or washing yourself. The glue and some stitches can dissolve by themselves. Other stitches might need to be removed, and the doctor or nurse will be able to tell you this after your procedure. If they do need to be removed, it will usually be done by a practice nurse at your GP surgery around 5 to 7 days after the operation. And you should be given information about this when you wake up. Your cuts will initially be covered with a dressing usually. You should be able to take that off about 24 hours after your operation, and you can have a wash or a shower. You might get a small amount of vaginal bleeding for 24 to 48 hours, even if you've had your menopause and even if you've had a hysterectomy during your operation. The vagina itself might bleed slightly. Experiences of your first period after a laparoscopy, if you are still menstruating, can vary dramatically. If your period is more painful, longer or heavier than usual after you have that laparoscopy, don't panic, because internal healing does take much longer than the external healing, so your first few periods might be more painful. However, if you're concerned about the degree of pain or if your pain is severe, do contact your doctor. Now, in terms of pain, you can expect some pain and discomfort in the lower abdomen for the first few days after the operation. You might have some pain in your shoulder. It's a common side effect of the operation. And when you're leaving the hospital, you'll usually be provided with some painkillers for the pain that you're experiencing. Sometimes painkillers that contain codeine or dihydrocodeine can make you sleepy, a little bit sick or constipated. If you do need to take these medications, try to eat some extra fruit and fibre to reduce the chances of becoming constipated. If you had a short general anaesthetic, once you're awake, you'll usually be offered a drink of water or a cup of tea straight away and something light to eat before you do go home. You should be able to have a shower or bath and remove any dressings about 24 hours after your operation. And when you do take that first shower or bath, you should have someone with you because you might feel a bit faint or dizzy from the heat. And don't make the water too hot. Don't worry about getting your scars wet, but when they do get wet, ensure that you pat them dry with clean disposable tissues or let them dry in the air. Keeping your scars clean and dry does help with the healing. Now, there's a small risk of getting blood clots in your legs or in the pelvis after any operation, and the longer your operation, the higher that risk is. These clots, if they occur, can travel to the lungs, causing a pulmonary embolism, and that can be serious. But if you can reduce the risk of getting these blood clots by being as mobile as you can early after the operation. You can do some gentle exercises even when you're resting, for example, pumping your foot up and down briskly for 30 seconds, moving your feet in a circular motion, and bending and straightening your legs one at a time, 3 times on each leg. You might also be given other measures to reduce the chances of a clot developing, especially if you've got extra risk factors for this. For example, if you're overweight or if you've got other health issues. So these might include daily heparin injections or compression stockings or even special boots that inflate and deflate that you should wear while you're in hospital. If your ovaries were removed during your operation, you might be offered HRT, hormone replacement therapy, immediately after the operation. This should be discussed with you by your gynaecologist, and together you can decide the best way to take it. Your gynaecologist or another member of the surgical team will usually come and talk to you after your operation at some point. Because you might still be coming around from the effects of the anaesthetic, if you do forget what was discussed, you can always ask the nurse that's looking after you to go over things again, or ask if you can speak to them again later. What can help you recover? Well, it does take time for your body to heal. There are a number of positive steps that you can take at this time. So, for example, having a good daily routine, even though you're recovering, still try to get up at your usual time, have a wash and get dressed at a gentle movement. If you do sleep and stay in your bed for long days on end, it can affect your mental health. So try to complete your routine and then rest as much as you need to throughout the day, maybe having some regular naps initially. It's very helpful if you eat a healthy and balanced diet and ensure that your body's got all the nutrients that it needs. A healthy diet is a high fibre diet, so having fruits, vegetables, whole grain bread and cereals and up to 2 litres of water per day can help to get your bowels going again after the procedure. We always recommend stopping smoking, but stopping smoking will definitely benefit your recovery from these sorts of operations. It reduces the risk of wound infections, chest infections, and also can reduce the risk of getting those blood clots. By not smoking, even if just while you're recovering, it will bring immediate benefits to your health. You may have a slightly slower recovery if you've got other underlying health problems. So for example, if you've got diabetes, you may heal more slowly and you might be more prone to infection. So when should you seek medical advice after a laparoscopy? Well, most women will recover very well from a laparoscopy, but complications can occur and we should always be on the lookout for these. You should seek medical advice from your GP, the hospital where you had your operation, or if you're in the UK, calling NHS 111 if you experience any of the following. So if you get some burning or stinging when you pass urine, you might have a urine infection and you might need some antibiotics. If you get red or painful skin around your scars, you might have a wound infection. Again, you might need some antibiotics for that. If you do in general experience worsening of the pain, or if you get a temperature, a fever, if you lose your appetite and you're vomiting more than expected, then there may have been some damage to your bladder or your bowel potentially, or worse, infections inside the tummy. Either way, you should get in touch with a medical team. Sometimes you might need to be admitted back into hospital. Or if you experience pain in your legs, if it becomes red or swollen, that may represent a DVT, a blood clot in the legs. If you've got any shortness of breath or chest pain, all of these can be signs of blood clots and you should again seek medical attention. So getting back to normal, well, you should resume normal daily activities as soon as you're able. So you might find that you're able to do a bit more as the days pass. If you do experience pain, make sure you're taking regular painkillers and maybe dial back a little bit on your activities for a few days. Do remember to lift correctly, so have your feet slightly apart, bend your knees and keep your back straight if you're bending down to get something from the floor. You can brace your pelvic floor and your stomach muscles as you lift and hold that object close to you and lift by straightening your knees. In terms of exercise after a laparoscopy, even the day after your operation, you should be able to go on a short 10 to 15 minute walk in the mornings and the afternoons and rest afterwards if you need to, and you should be able to increase your activity levels quite rapidly over the first week. There's no evidence that normal physical activity levels are in any way harmful. Most people should be able to manage a kind of a 30 to 60 minute walk by the middle of the first week and back to their previous activity levels by the second week. Swimming is great exercise, and if you haven't had any additional surgical procedures, you can start with that as soon as you feel comfortable. If you have had an operative laparoscopy, you may need to avoid contact sports or high intensity exercise for a few more weeks, and your doctor can provide personalised advice on this. The driving, you shouldn't drive for 24 hours after any general anaesthetic. Each insurance company will have their own conditions for when you are insured to start driving again, so check your policy before your operation. Before you drive, you should be free from any sedative effects of any of the painkillers. You should be able to sit in the car comfortably, you should be able to wear your seatbelt comfortably, and you should be able to make an emergency stop if you need to. Now, it's safe to have sex when you feel ready after your operation, unless you've received specific advice otherwise. If your vagina feels a little bit dry, especially if you did have your ovaries removed during your procedure, you can try using a bit of lubricant that you can buy from your local pharmacy. If you had any procedure that involved more of the vagina, you may be told to avoid sex for a longer period. In terms of returning to work, most women feel able to return to work 1 to 3 weeks after a laparoscopy. If you had a diagnostic laparoscopy or a simple procedure such as a sterilisation, you should expect to be able to go back to work within about a week. But if you had a procedure as part of an operative laparoscopy, like removal of an ovarian cyst, you can expect to return about 2 to 3 weeks after your operation. If you feel well, you may be able to do some light work on reduced hours after a week or so, but when you do go back to work will depend on the type of job that you do. So if you've got heavy manual work, you're on your feet all day, you may need to sit down longer than someone who can spend their days sitting down at work. If you are off work for less than 1 week, you should be able to complete a self-certification form. But if you are going to be off for longer than a week, you need to obtain a certificate from the hospital where you had your operation. You might also wish to speak with your GP or your occupational health department before you go back and discuss if any additional measures may need to be put in place for you to return to work. You shouldn't feel pressurised by family, friends or your employer to return to work before you feel ready. You don't need your GP's permission to go back to work, though the decision's yours. So let me know if you have any other questions about having a laparoscopy, or if you've had one yourself, let us know how you get on.